Thank you, Honourable Speaker, sir, and I thank Honourable Rabuna for his question. In answering the question, allow me to please elaborate on why the critical shortage and the strategies that the Ministry is undertaking to address the critical shortages. So dental assistant and dental hygienist roles and responsibilities are almost the same. It's a one-year course. Dental hygienist, dental assistant, and dental hygienist is a 2-year program. So prior to 1998, there were junior dental assistants graduating from FSM back then with certificate in dental assistant, which is a 1-year program. And very few dental hygienists in Fiji then, with a total number less than 10, while junior dental assistants dominated the dental workforce. And in 1998, 6-month bridging course was developed by FSM, engaging dental staff from the Ministry of Health and Medical Services. This all upgrading to junior dental assistant in the public hospitals. These junior dental assistants were all upgraded to dental hygienists, graduating with a certificate in dental hygienist at the end of 1998. So dental hygienists then perform duties of both junior dental assistants as well as dental hygienists. So in 2018, the last batch of dental hygienists graduated from the Fiji National University, and the program ceased from continuing. So the reason for ceasing was there are not many interested in the dental hygienist program, and most high school leavers opted for dental course to become full dentist or dental officer. And then the FNU then introduced a new enrollment system where all school leavers offers to undertake the Bachelor in Dental Surgery program, to undergo the first 2 years together, with those attaining higher marks at the end of the second year proceeding to the Bachelor of Dental Surgery program with a total of 5 years training to become fully fledged dental officers. Due to the shortage in the dental hygienists in Fiji, the government in 2014 offered 20 scholarships, with 14 being enrolled at FNU, and 7 completed the course and graduating after 2 years. So in 2022, Fiji National University has commenced training of dental assistants in a 1-year program. So at the moment, the total establishment for dental hygienists is 80. Total fill is 27. Temporary vacant is 3, and vacant post is 50. In answering the strategies, the ministry is re-engaging dental hygienists retiring at 55, re-employing dental hygienists not vaccinated, re-engaging dental hygienists over 60 but who are certified medically fit. And we are working with our own Human Resource Department, and a submission will be made with regards to these strategies in the next few months. Nevertheless, we are also being active in those initiatives that I've mentioned, Honourable Speaker, sir. In terms of, there are also plans to in creation of the dental assistant post within the Ministry of Health and Medical Services, and the new graduates to perform duties, roles, and responsibility of dental assistants, currently undertaken by dental hygienists in the public hospitals. So in a nutshell, FNU has ceased the program, and the ministry in strategizing how it will cater for the current vacancy as it is. Like I've mentioned, rehiring 55 and above, ensuring that those that they were not vaccinated get hired back, and ensure that those over 60 who are still medically fit, able to be hire them for on a contract basis. Nah.